was like, to myself, I'm thinking, well, if not me, someone who has lived 10 plus years with children in active addiction, then who? I think there's so many people that stay silent, and we all have a voice, and we need to use our voice, otherwise there will be no change. Just a couple things about YPR. Like I said, we're an advocacy organization, and we're always looking for members. You do not have to be in recovery to be a member of YPR. We have family members and supporters in recovery. And also, September 21st, we are having our 5th annual Laugh for Recovery Comedy Benefit. Any information you can get from our resource table. Once again, I'd like to thank you all for coming, and I would like to introduce John Rogan.
Good evening, everyone. My name is John Brogan, and I'm a person in long-term recovery. Very grateful person in long-term recovery. First start with if we could do a little bit of a moment of silence for all those who have lost someone. I see a couple of families in the room that I knew, so we could just take a couple seconds and remember those. Thank you. I see Mrs. Dishon right there, and it's always a mixed bag for me on nights like this, because I remember so many times going in and out of recovery, and just trying as hard as I could on my own willpower to get this thing, and I just could not. I did not understand what it was. I understood what happened to me. I got used to it, whether it was a jail or a hospital, 4 overdoses, until I just finally tried to take myself out. And it was, and I had 3 daughters. I had a wife, and none of that stopped me. There's a little line in our literature. It says, frothy emotional appeal will not suffice. And for any of you out there that may not understand what the disease of addiction or what it is, that line explains it all. And I was made to look it up when I came into recovery. And it means that with my mom and my loved ones and my dad and everyone saying to me, why can't you just stop? And I can remember those times. And I can also remember in retrospect going back thinking to myself, I want to stop and I just can't. Because it treats what's wrong with me. And what's wrong with me was an internal condition that's a God-shaped hole. So I'm here tonight. I'm honored to be here. I have 7.5 years clean today. I have my 3 daughters in my life. And I say that because there's nothing I did to do that. I really don't. I say that all the time when people celebrate. It's happy anniversary for me, because for me, it's God reaching out and grabbing me by the back of the shirt tail and saying, okay, time's up. Because left to my own doing, it's a wrap. So I'm up here tonight to introduce, my opinion, a very, very special man. We are lucky in the county we're in, looking out and seeing the partners we have. With Chief DeBella, New Jersey Reentry, Governor McGreevy and Josie, Gary and Christian and Integrity and Cindy, and the Hope Sheds Light, and everyone that's here, Donna with YPR. And this community has come together, in my opinion, because of Prosecutor Joe Coronado and Tom MacArthur. Without that leadership, we would not be doing what we're doing. People look at addicts, slang term, people in recovery, as you know, it's great that they're sober, but do we really want to work with them? And you know, when we started these programs, I had to really have some recovery in me and look at why people spoke to us like that. Like when we went into the emergency rooms at first, and the doctors I had to say to them, I understand why you look at us like this. We come into your emergency rooms overdosed, we yell at you, we curse at you, and we leave and we don't pay our bills. Right? Harry's laughing. Why would you want to sit here? And we do some damage. But on the flip side of that, it's leaders like what we have here that looked beyond that and measured us by who we are today and our actions, not our words. And they stuck by us. And I can tell you, all the way down to Washington, D.C., I testified before the Heroin Bipartisan Task Force, and we are 100% leading the nation in the programs. And everything that we can control, we are leading the way, no doubt. And I'm very proud of that today. So, again, Prosecutor Coronado and you know, Congressman Tom MacArthur, thank you. There is, you know, last year it was 300, me and Prosecutor go back and forth. He says 379, I say 389, but 389 lives last year that walked into a police station and we were able to assist them through recovery. And that was due to all of you. That's the team environment. That's the me yelling at Cindy, Cindy yelling at me. You know, we were laughing about it before. It literally takes a country, you know, to do this. And this year, still waiting on Cindy's numbers, but I think we're already this year at those same. We're at the 400 number, you know. And why is that when you think about that? Why are individuals walking into a police station? Would have never happened without these two guys. Never, never, never in a million years. So a lot to think about. There's a lot of hope in here. We just launched another program inside the jail, which we're going to be duplicating in Ocean County, up in Monmouth County. And in 19 days worth of work, we've interviewed and assisted 312 individuals. So it's a pendulum that's shifting, but it's a lot of work, and we need everyone in here to do it. And the man that has helped us do all this, you know, I cannot say enough about. I'm going to make this little pitch for one reason and one reason only. We really, really need him. We need him in the space, not just because I like him, but we need him in the space because he's continuing to keep the funding going to the organizations, the grassroots organizations that need to be doing it. He continues to push and fight for people suffering from substance use disorder. He pushes for the families, he meets with the families, and again, it's actions, not just words. And you know, I will attest to that firsthand. So I will make the little pitch and say we need you all out there in November. It is my distinct honor to introduce Congressman Tom MacArthur.
Well, good evening. Thank you, John. And I do want to echo what you were saying about our prosecutor. Joe Coronado really has cared about this issue, and he's done an awful lot of good to help people. And law enforcement has changed, and there are a few people that have led that change. And I can tell you, in the state of New Jersey, our prosecutor is one of the leading ones of those. So, Joe, thank you. You have saved lives. I think this is the third time I've come to this event. And I come for a really simple reason. I really love what young people in recovery do and what so many of you do, but it's as simple as this. If my presence and a few words about what we're trying to do in Washington can give you some hope and encouragement, then I'm really happy to be here. I'm really happy to be here. I'm not going to sugarcoat the nature of the problem. You all know it as well as I do, and it's actually not getting better yet. Last year we lost 72,000 people across this country, 72,000 individual lives. Every one of them somebody's son or daughter or mother or father or grandson or granddaughter or niece, nephew, close friend, sibling, husband, wife, child. Every one of them hopes and dreams that were stolen away. And everyone is tragic. And some of you in this room, I would venture to say, most of you in this room know some of those people. The year before it was 60,000 lives. So how, with all this work, did we go in the wrong direction? That's the nature of the problem. Of those deaths, and this is really alarming to me, 30,000 of those 72,000 deaths involved fentanyl or some other synthetic opioid. The year that I ran for the United States Congress, 2014, 15%, and this comes from our prosecutor, 15% of the overdose deaths in Ocean County involved fentanyl. The first 6 months of this year, 85% of the deaths in this county involved fentanyl. This is a new wave of this crisis. So we have still a major problem across the country. And it's going to take all of us at every level, local, state government, federal government, nonprofits, families, community organizations, groups that are involved in recovery. It's going to take all of us to stem this tide. The federal government has a role in a couple of important ways. Now, I chair, as John said, I chair the bipartisan heroin task force. There are two of us, two chairs of the committee, one Republican and one Democrat. And we have agreed, my co-chair and I, that, and it's Annie Custer up in New Hampshire, another state that's been devastated by this crisis, we have agreed that we will not bring legislation forward. We will not push anything unless it has support of both the Republican and Democrat leaders of the task force, and the bill was introduced by both a Republican and a Democrat, because this is too important to play politics with. And in the month of July, before we went on the summer recess and came home to be with our constituents, we passed 50 bills that were sort of like rifle shots, each of them trying to get at some element of this crisis. And I hope this will give you a little bit of hope, because we are doing things that will help. I can't go through 50 bills. You'll string me up if I try to do that. But I will mention a couple of them, one because they're so important. One of them lifts what's called the IMD exclusion. This is a rule at the center, at Medicaid. It's a rule at Medicaid from decades ago that doesn't allow Medicaid to reimburse a treatment center if they have more than 16 beds. Now, how nuts is that? And it came out, they called it warehousing. They didn't want to warehouse people, so they weren't gonna pay these bigger facilities. If you're struggling with substance abuse disorder, do you care if there are 16 or 17 or 50 beds? No, you need help. And we need to be able to help people. So we lifted that exclusion. Now we're calling on the Senate to do the same thing. We passed a bill that I wrote that helps the Center for Medicare Services to deal with stolen Medicare numbers, which are being used to do pill dumping in communities. And just yesterday, I introduced a bill called the Alert Act, which would allow and require the government to help all of the people involved in paying for prescription drugs. Private insurance, government programs like Medicare and Medicaid, CHIP, all of these different payers. It would take all of that information and allow it to get analyzed by computers and send red flags out to those that are filling prescriptions. So we are working on some things. I was really grateful that of the 50 bills that passed, 30 of them were written by members of my task force, 30 of them, and 5 of them were among our top legislative priorities. So we are working at things dealing with prevention and treatment and long-term recovery and dealing with fentanyl in particular, dealing with border issues where a lot of heroin is coming across the southern border. So we're working on things. And we're trying to support local programs. I was with the prosecutor this morning at a program called Top Gun. The face of law enforcement has changed dramatically. And it's less today about incarcerating people than helping people. I think, and I talk to a lot of police officers, they are more interested in helping people stay out of the system than get into the system. They're more interested in helping people get in recovery, long-term recovery. And so I was at this program where prosecutors and police officers, detectives, other law enforcement officers are being trained in a lot of different things that'll keep them safe and save lives on the street. The other thing the federal government can do and must do is provide funding. We're the only thing big enough to provide the funding necessary. The state of New Jersey is broke, among other things, but even if it weren't broke, the state can't provide the federal government's the only thing. And earlier this year, we included $4 billion of funding, the highest number ever in our funding package, specifically for opioid and other addiction issues. $1 billion of that $4 billion was dedicated to states to help support programs. $500 million, $500 million was sent to National Institutes of Health for them to study non-addictive painkillers and other things that can help to avert this crisis. We also fund things like high-intensity drug trafficking areas, HIDAP. Ocean County, due to a lot of hard work by people here in Ocean County, our prosecutor, and again, a bipartisan effort, Senator Cory Booker and myself worked with the prosecutor to get that designation. I'm sure he'll talk about it, and in fact, I won't talk about it, so I don't make him repeat it. But there's been a lot of good that has come out of that designation, and again, will save lives. And then just this week, I was able to announce 2 grants in South Jersey for programs out of the Drug-Free Communities program. $125,000 for a program in Burlington County, and $125,000 here in Ocean County for the DART program. So those things matter, they make a difference. I will leave you with this thought. Maybe I'll leave you with 2 thoughts, actually. The first is, about a week ago, I was in Burlington County for an opioid roundtable. And I had people both from law enforcement and from treatment. John Brogan was at that, actually. And one of the things that struck me at that roundtable, as we talked about different facets of the crisis and what we can do about it, is that alone, we're sunk. We're really sunk alone. Not just with these groups like law enforcement and treatment and recovery, they need each other, but together we actually can overcome. I think that applies to every single individual. And this is my second thought. If you're here tonight in recovery, if you are here as a family member with a broken heart and struggling through the crisis of this, alone we are sunk. As John said, you can't just will your way out of this. You can't. Addiction becomes a disease that overcomes everything. And so you can't overcome alone. Together, I believe we will overcome. There are more of us than those that want to push this on our loved ones. There are more of us, and we will win together. And with that, I give you just my and God bless you, especially those of you that are working through recovery now. Thank you.
All right, normally I don't stand behind podiums because I'm hard to be seen. But name's Mike DeBella. I'm the Chief of Police for Lacey Township. First and foremost, I need to thank every single one of you here, all the organizations, all the people sitting here, for being here tonight, because if it wasn't for you, this program, this event would not be successful, so thank you very much. I have the honor this evening to introduce a man that's not only changed, but drastically improved law enforcement response to the heroin epidemic, not just in Ocean County, but really across the state of New Jersey, and then some. He's responsible for bringing Narcan to law enforcement, again, not just in Ocean County, but very instrumental to bringing it for the whole state. Also responsible for bringing the ORC program into hospitals along with John Brogan. But most importantly to me, instrumental in starting the Blue Heart program that the Congressman has talked about. We do that program here in Lacey Township. I think most know what the Blue Heart program is, but for those that don't, it's really, you can walk into a police department a specific day during the week, like Lacey Township is on Monday. You know, if you have an addiction or to heroin or opiates or a dangerous drug, and you can actually come into the police department and ask for help and be provided help. To date, now we've probably been doing this about 13, 14 months now. We've had over 60 people walk into our police department, men and women of all different ages. Just a really good, program.